Good afternoon, everyone. I am Joseph Angelo Rayo, a Master of Arts in Development Policy student of De La Salle University and Medical Officer at the University of the Philippines, Manila, Philippine General Hospital, Department of Psychiatry and Behavioral Medicine. In the next few slides, I will be arguing on the importance of undertaking regular and frequent updates on the health condition, changing policies and interventions, which is part of the first policy paper related to COVID-19 published by the DLSU JRIG, and how such measures influence the behavior of an individual and the public as we try to respond to this pandemic. To establish the relationship of measures like frequent and consistent COVID-19 updates and related public service announcements on the behavior of the public, we need to look back into Beckers' health belief model, which is often used by the medical community in creating effective preventive public health programs. The HBM hypothesizes that health-related action depend upon the simultaneous occurrence of three classes of factors. First would be the existence of a sufficient motivation or health concern to make health issues relevant. Second is the belief that one is susceptible to a serious health problem, otherwise known as the perceived threat. And last is a belief that the following a particular health recommendation would be beneficial in reducing the perceived threat and at a subjectively acceptable cost, which are the perceived barriers that must be overcome in order to follow the health recommendation. As you can see in the framework, the perceived threat of a disease, in the present case the COVID-19, is affected by many factors like intrinsic, demographic, and psychosocial factors, and personal perceived susceptibility to it, as well as external cues to action that may come in the form of personal experiences, advice from others, and mass media campaign like public service announcements and regular updates from the authorities. Taking all this into consideration, we therefore can predict the likelihood of an individual or the public in general taking and obeying a recommended preventive health action. At this point, we then look back into the past 6 months or so on how the government has carried out its public service announcements and updates. These are only some of the confusing and contradicting pronouncements of the IATF, the one in charge of our national response versus COVID-19. The physical distancing in public transportation is contradictory to what the WHO has recommended since the beginning. Social distancing is absolute and not relative. On the use of rapid test versus swab test or RT-PCR, the RT-PCR remains the gold standard. On the reversion of NCR back to NECQ for 2 weeks because of the rise in COVID-19 cases, the healthcare sector has asked for an ECQ and not NECQ. And on the use of motorcycle barriers, how will it be beneficial if at the end of the day, the riders will be sharing one bed or staying together under one roof? I therefore beg to ask the question, with policies like this, how can we expect the public to adhere and obey the standard health recommendations when the facts itself are muddled with misinformation and confusion? Projections show that confirmed cases are still on the rise without a sure hint of decline. This clip illustrates how the Philippines fared in public information campaigns in comparison to Asia and the world. It shows that as early as January, we had carried out coordinated information campaign at par with countries that have successfully adapted into the new normal. But how come we are still peaking in thousands of new cases daily? Are we doing enough as a country? And to guide countries with problems like ours, the United Nations has released the RCCE, or the Risk Communication and Community Engagement Action Plan Guidance, COVID-19 Preparedness and Response. This is a tool designed to support risk communication, community engagement staff and responders and other partners to develop, implement, and monitor an effective plan for communicating with the public, engaging with communities, local partners, and other stakeholders to help prepare and protect individuals, families, and the public's health from COVID-19. The RCCE emphasizes on the following key considerations: adapting the elements according to your country needs and situation, revising action plans accordingly, coordinating and planning together with authorities and partners, proactively communicating and promoting a two-way dialogue with communities and the public, reducing the stigma, conducting early and ongoing assessments, and ensuring that all people at risk of acquiring COVID-19 are identified, reached, and involved. Thank you for your kind attention. Animola